Thank you for coming today. Welcome to our research seminars. Very interesting series of presentation today on software support in population health intervention. The topic is dear to the people who are listening in. Roy Cameron, I know, is in the background of all of this, and this work recently was submitted as a proposal to, which was it, to CHIRP, the Collaborative Health Research Projects Grant. So this is a very, very active research area here at the university, both in applied health sciences and together with the computer systems group in computer science. Don Cowan will be speaking. Don, known him for quite a while now. I think he's suffered worse than I have. Don started computer science here at the University of Waterloo, was the first chair of the department. Over the years, he's had quite a few involvements, both within computer science and in companies that surround the university, and he may mention some of those as he goes on. He's currently a professor emeritus in the School of Computer Science, written a lot of papers, and continues to do that together with Paulo Alencar, who is a collaborator on this particular project. So, Don, I welcome you.
Thank you. I haven't said anything yet. What I want to talk about today is it says software support for population health intervention. Software support, notice, is first, and the reason is I don't know much about population health. You'll find out that those of you who are knowledgeable in this area will find that out very quickly. But I think I know enough to understand their problems and what they need to do. As Dominic said, this work is really in some sense a culmination of a research proposal that has gone into the CHIRP program at NSER. We were invited to submit it. And Paulo Alencar and I put most of the work in it, so we're sort of co-presenters, if you will, even though I'm actually going to make the presentation. I'm going to talk somewhat about population health and the way I understand it, and then show some of the things we might do for software support, and then demonstrate where we are. First of all, my interests very much are not only thinking about software and doing things with software, but doing things with other partners who have problems, if you will, because I often find that shows up all sorts of interesting issues that you wouldn't think of yourself. So this particular research program is a partnership, and I listed the three groups that are involved: the Computer Systems Group, which is our research group; CBERPI, which is the Center for Behavioral Research and Program Evaluation, and is an institute basically sponsored by National Cancer Institute of Canada; and the Waterloo Institute for Health Informatics Research. I don't know why I'm having trouble with that one. And this is the list of the people involved: Dominic Covey from WIR, Roy Cameron and Steve Mansky from CBERPI. And there's other people in these organizations that have supported this work, by the way, but I decided to restrict myself to one slide. Shirley Fenton, Doug Mulholland, Anthony Robbins, Kyle Young, and David Chodos, who's doing some current work on it and is a graduate student with us. First of all, chronic disease. There are three, what you might call major chronic diseases: cancer, cardiovascular issues, events, however you want it, because that is a lot. It's not just your heart. It can be circulatory system, can be your lungs, a whole bunch of different things. And diabetes. These are three very prominent chronic diseases. Why are they prominent? Because they cause a lot of what some people call premature illness. That is, illness whose onset occurs earlier than you would expect. A lot of premature death. People, for instance, with diabetes come up with all sorts of interesting problems. Kidney failure is one, gangrene's another one, blindness is another one, et cetera. So they're very circulatory, which sort of feeds back to the cardiovascular problem. And so these three diseases are major drivers of health costs. They are a significant load on the healthcare system. So obviously, if you could do something with that. What happened here? What have I done? There we are. And interestingly enough, my population health friends tell me that they are largely preventable if you do three things. You basically stop smoking, if you smoke at all, tobacco use, poor eating habits, and lack of exercise or inactivity. So you've got these diseases. They're significant in terms of their impact. and yet we can do something about it. Wow, that's great. So the thing is, you'd like to make changes in people so they would avoid, they'd eat well, they'd get lots of exercise, and they wouldn't smoke. How can you do that? We can work on individuals. I can take anyone in this room who has those issues, if any of you do, and put them through various counseling sessions and what have you, and all sorts of other therapies that I don't even claim to understand. But boy, that's an expensive way to treat people. So what you want to do instead is look at population change rather than individual change. So you want to look at large groups of people and institute policies and practices that would change their behavior. And I put 3 down here that are policies and practices that might change people's behavior. One was one that is not around anymore. It's called participation, which was basically exercise, and an exercise program that was pushed very hard. You saw ads for it all the time in the newspapers. Pictures on cigarette packages. If you ever buy a package of cigarettes, they're there. Supposedly, those pictures discourage you from smoking. And the third one I put down is kind of an interesting one because it's a little different. I put volleyball in Moncton, and Moncton is in New Brunswick, for those of you who don't know where it is. And the volleyball part was that a school had a significant smoking problem, and they decided to do something about it. And their action was to bulldoze the so-called smoking pit, put up beach volleyball, and do a number of other activities as well. And I don't even remember them all. I've been told the story a few times, but and this had a great effect on the so-called smoking health of the school. The prevalence of smoking went way down. So those are examples of policies and practices that might go into effect. And kind of keep the volleyball one in mind, because I'm going to bring it back later as an interesting idea that shows some, amazingly enough, some things that are related to software. And what volleyball has to do with software, you'll find out shortly. So how do you measure the effectiveness of any of these policies and practices? How do you decide that they're working? And some of them, I'm not quite sure still to this day how they decide, but you can't do random control trials. They don't make sense, because if you try to do random control trials, you really have a short chain between the trial and the results, so to speak. Here, you can have all sorts of effects coming in that just make random control trials ineffective. So what has been proposed, and seems to make sense, it's not perfect, but seems to make sense, what they've called natural experiments. And natural experiments is you do an experiment over a large population, and you look at change against time or change against place. Change against time meaning I took a measurement this year on a large population. I did something, and I waited a year and took the measurement again, and gee, there was a change. There's probably a good chance that I did something worked. Change against place is you take 2 comparable places, and this is almost a bit like a random control trial, and you take 2 comparable places and do an experiment on one and not on the other and see what happens. Well, in order to do that kind of thing, to measure this effective, you've got to have some data. You've got to have a way of saying, okay, I made these measurements today, and I made them a year from now or 6 months from now. I have what they call an evidence base. And you can do these measurements, I say, over time or in comparable locations. And at Waterloo, we have such an evidence base. And they're working on several, but I'll mention the one, and I think I've got most of the points captured here. It's called the School Smoking Profile. And the prime drivers, but not the only people involved by a long shot, are Roy Cameron and Steve Mansky. I say I could list quite a few people out there, but the list would just overwhelm the slide. What they have done is they have gone to a group of schools in Canada, not all of them, but as it says here, 600 schools with 150,000 students. They have put across a questionnaire in the school to all the students, asked them a series of questions about their smoking habits, and they've built the questionnaire in such a way that they can be fairly confident that the results are probably valid. And they then collect this information, and it gets sent back to Waterloo. It's basically done on paper. It's Mark Sense forms, so the thing is wholly machine processable. But currently, that's what happens. The school submits their information. They reports. They get a report out of it. They can take the paper, generate a report. The report goes back to the school and maybe the local public health authorities. In other words, the people who are very concerned about the local community. Doesn't go any farther, as I understand the system now, having had it explained quite a few times. There is another, now there's a really nice thing here, because this school smoking profile, the people who are doing this within CBERPI have now got an entry to the school system, which is often difficult to do. The other thing they've done, which is very effective, which is important and yet seems minor, is it only takes 20 minutes to do the survey for each student. So they don't impact the school in any significant way, and yet the school gets value back. So it's a win. It sounds like so-called win-win for everybody. There is a second one underway called the School Health Action Planning and Evaluation System, SHAPES. And if you look at what they're measuring, you can understand the acronym. Nutrition, do you eat well? Obesity, because we know it's becoming a bigger and bigger problem, and physical activity again. There may be other things in there as well. These are the ones I'm aware of. It's under development right now, but the concept is very similar to the school smoking profile, same kind of checking, validity, et cetera. And this is primarily being driven right now by Steve Mansky. So there is an evidence base that is here and of value, and there are other evidence bases being collected probably over the next 2 to 3 years. Okay, with the school smoking profile, we have a number of interesting issues. You have all this information. Boy, is it ever valuable. I mean, no one else has got this kind of thing. I think this is unique in the world. As far as I understand it, it is. And yet it's very local. Nobody can get at it except the local school, because, in effect, they get a mailing back that says, this is all about your school. And yet, when you think about it, this information has lots of value. It has value for researchers, people who are looking at behavior change, in effect. How do you intervene on a population level? By the way, remember, population doesn't have to be the whole country. It can be a school. It just has to be a large grouping. We can look at program leaders, policymakers, people, and at all levels, federal, provincial, and local. And what happens is now you can, with this evidence and with some information about what the evidence means, you can figure out what works and where does it work. For example, one observation that has been made as not, I think has been pretty thoroughly tested now, but I'm not 100% sure, is if you go into a school where there is no, where I call it the smoking health is good, in other words, not a lot of people smoking in the school, and you kind of make a change there. I mean, this is an obvious statement, but no one has ever tested it, or hadn't until recently. If you go into that school, you don't have to make any changes. You can try as much as you like, but nothing much will happen. However, if you go into a school where there's a high smoking rate, or the smoking health is not good, then you can make significant changes. I like to think of it as return on investment. In other words, you put in $1 in, and you make a large change relative to putting into $1 into a school which is so-called low risk, where there isn't much smoking going on. Of course, as well as the evidence base being valuable to policy makers, it's also valuable to opinion leaders and media. People who stand up and say, I don't smoke for the following reasons, or you shouldn't smoke for the following reasons, or whatever. The problem is, how do we share access to this data and other evidence that may come up? And so what we need is an IT infrastructure, an information technology and communications, I should have put that in, infrastructure that allows people to share this somehow. And what the next part of this talk is about is what is that, what might that infrastructure look like? And this is basically what we asked for money for, to set it up. Parts of it already exist, and I'll show you some examples of that at the end of the talk. So we need what we call a national IT asset, okay, to share this information. And what does it look like? Well, first of all, to start with, we have the data represented by the school smoking profile. And currently, by the way, that data exists. You can get it, but it's not in a database format. So our first thing would be to put it in a can, if you will, called a database. Then we would try to make that data available to various local, provincial, and federal authorities. Local authorities being the schools, the public health officials, maybe local politicians who have an interest in it. If you recall, we have a no smoking policy in Waterloo region now. Obviously, local politicians had something to do with that because they passed the bylaws. At the provincial level, the Minister of Health in Ontario has been going around talking a lot about behavior change, and they are trying to institute policies to make that happen. In fact, they've split the Ministry of Health into two parts, one part to deal with acute care primarily, and the other one to deal with population health. And I think they're still struggling to figure that one out because that just happened quite recently. And then the third one are the federal people, and I always think of them as the people who put those terrible pictures on cigarette packages, but I'm sure they do a lot more than that. It's just my way of characterizing them. What kind of information would you like to get out of this asset? Well, all sorts of reports, various kinds, rank the schools by smoking health, statistical reporting. How does income relate to smoking health of a school, like the demographics of an area, for example. Graphics, well, obviously you'd like to present it in ways that are, I'll say, more meaningful or appealing to people that they can sort of grasp without going through a lot of numbers. Multi-layer maps, you might like to be able to show schools. Do they relate to each other? How do they relate to stores that advertise cigarettes, for example? So you could plot in a community, you could plot the stores that advertise cigarettes, have, say, signs in their windows or whatever, against the school. Now, would removing those signs change anything? I don't know, but it's an experiment you could easily try. Multimedia, we want to be able to present ideas in various ways, perhaps capture some experiences. It's got to be secure. There's a whole bunch of issues around this. The province of Ontario right now produces lists that describe, I'll say, the smartest school and the dumbest school, so to speak. I mean, they're not necessarily smart and dumb, but they have indicators. Could we do the same for smoking? Would this cause parents to have a fit? I don't know the answer to that, but it's something you have to worry about. The other thing is, we don't know what the heck people, the people out here that are doing this work, what they want. We can guess, but we don't really know. So we have to have a fair amount of ability for the user to warp the system to their needs, if you will. So that's step number one. Step number two is the following. So we have this thing in place now. Great, terrific. The first thing that happens, I hope, is that there are a large number of people out here who start to share experiences. So you have experiential things, like the volleyball incident. Wouldn't it be nice if other people knew about that? Because they might either duplicate it, or they might find, or they might put a twist on it. If we're in the wrong city, volleyball might not be the choice, but maybe you do something equivalent. All sorts of other data could come in, plus the school smoking profile itself could expand. So this whole thing can grow. It's sort of almost organic. As people join, they start to add information. And what we end up with are communities of practice, I call them, or COP for short, just so I can get it on the slide, which basically we end up with all of the, particularly, let's say, the federal people working together in various ways. They may be in different departments. They may not all be in the same department. What about, there's the Canadian Public Health Agency, which deals with everything but smoking. And then there's Health Canada, which deals with smoking. Well, these people would want to work together because, again, one experiment in one area may produce an experiment in another area. The provincial people, the same thing, different areas. The local people, I would like to know what people are doing in other communities to change the smoking health of the school. So we think of these communities of practice. The thing is, the communities of practice, they're not vertical in the sense on the diagram, but they're vertical in the sense that they just involve one particular sector. And yet, we want these people to be talking to each other as well. So there has to be at least one other community of practice. And by the way, there could be many communities of practice. I'm just highlighting 4 right now. This one would cut across the silos, if you will, the sectors. And why would you ever want to do that? Well, I'll go back to the volleyball thing. Well, that volleyball thing turned out to be really interesting and very effective. I don't know if they've actually done any measurements or not. I've just heard it reported, so I don't have any information there. But if it is an effective method, then the federal people or the provincial people might come along and say, you know, maybe instead of putting pictures on cigarette packages, we should be sponsoring community initiatives. Maybe we should have a fund whereby people can apply for $10 or $20 or $100,000 that change the way their community operates. And then we watch these experiments over a period of 2 or 3 years, and then the good ones we make available across the country. It seemed to me to make sense. Now, there's some other strategies that have been tried at that level which don't make a lot of sense and have similar things with them. So yeah, you have to be careful. But this one, to me, I thought about it a while, and it seemed to have a lot of sense behind it. So the problem is, what's happening here is this data is starting to grow organically. And it's, you might think of it as the mini web in some sense. By the way, this would all be web-based. I think that's probably pretty clear. But you can think of this as the mini web. And it's getting out of control because people just can't spend all their day in front of a computer looking for information. They got to do their real job, if you will. And most people's real job, although they do spend a fair amount of time in front of computers, it's not meant to be the overwhelming part of their job. So we have to figure out a way around that, that we can, in effect, treat this almost like an appliance. That's the way I like to think about it, where it delivers information to you when you need it, you know, right information to the right people at the right time. And so each individual that would join this system would create a contract with the system, describing their particular interests, needs, etc. You can think of it as containing an interest profile, and they would also specify in it that when they would like to hear about things. You know, maybe I devote 1 day a week to worrying about this specific aspect of the program. So 1 day a week, I want to get all this stuff. I don't want to be bothered at any other time, okay? So the idea of describing what you're interested in and the describing, the ability to describe how you want that delivered. So this is sort of the vision we have now of such a system. And there's an incredible amount of work to be done here, although it may look simple when you start looking at it, thinking about it. So for instance, the user contract, you really have an interest profile, and as you know, everybody in the world, everybody who speaks English in the world, even within Canada, uses different words for the same thing. So right off the bat, you need to develop some kind of common way of speaking about things, otherwise your information system will be impossible to manage. So you have to have a common language, you have to develop relationships among the terms, etc. The other thing is you want time in here, so you want to be notified. You want to be notified on your terms, not on the system's terms. You want to turn the system from a pull system, which is the normal web right now, into a push system, so it pushes information out. You don't have to drag it out. It pushes it out at you. And by the way, the contracts, of course, could be changeable. I mean, they're not static or anything like that, because your interests will evolve over time. And finally, we can have a bunch of little pieces of software running. We call them agents. I call them housekeeping agents because there are different versions of software agents out there. But these housekeeping agents would scurry around and do most of the background tasks that need to be done. You wouldn't have to touch the system. Again, if you can imagine walking up to the refrigerator, the door opens, you're handed your beer or soft drink or whatever. That's the idea. It's an appliance. And to me, I think this is a key idea in the whole thing, is that we want to make these systems a lot more usable. We've got to get away from too much interaction with the users. Now, what approach are we using to do this? And by the way, anybody who's looking at the web, the slide is a little different, but I will mention all of the things on it. As usual, I changed it at the last minute. First of all, we're building web-based systems. I mean, that's obvious, the delivery of this stuff. The current best mode of delivery is over the web. Our approach is component and web-based, meaning we take components and glue them together. We try to minimize programming and maintenance. In fact, we sort of have a rule in our lab that says if you have to program, you sort of go into the corner for a while and think about it and think if there's a better way to do this. Because, again, programming introduces details that the users don't want to ever see. So if you're going to have to program, you've got to hide it. We also want to minimize maintenance in the sense that you may have to maintain things, but is there a simple way to maintain them? The systems we build are primarily built through completing forms. You sit down, if you want to report, you just describe it in a form, and excuse me, the report gets built automatically. So it's a declarative system in that sense. We talk about what we want, not how to get there. The technology is well established, but we still got a lot of work to do on it to make it better. It's one of those things where we've done something and now we're stepping back and trying to understand truly what we've done. It's based on declarative things. We use XML tagging. This allows us a lot of benefits. There's a lot of very good tools out there that we can kind of grab. It also allows us to convert fairly easily to some common formal methods, which will allow us to do some proof fairly easily. Our approach is also, we sit down and we develop theories and tools, then we try them on real projects. So, and then this goes back, it's a feedback loop, of course. We go from trying them on real projects, develop the theories and the tools. We keep finding interesting things that need to be developed that were not obvious to us when we started. We have a toolkit approach in the sense that the toolkit is been evolved over time, and I think this describes roughly the content of it at the moment. We call it the WIDE toolkit, courtesy of Dominic Covey, the Web Informatics Development Environment, or if you like, the Waterloo Informatics Development Environment. It's, first of all, we have web-based database presentation and maintenance. We have reports and multimedia. One of the interesting, powerful parts of this thing, I mean, not the only one, but one that catches a lot of people's attention is the mapping. Mapping has become an extremely complex business. We have these things called geographic information systems, which typically require you about a year of school to learn, and then you become, I'll call it a geographic programmer in some sense. You go in there and you create stuff at the program, primarily at the programming level, and developing applications is quite complex, and that means that the users typically never get to, they just get to see the product, they never get to be involved. We've taken a different approach. First of all, we don't use GIS at all, except as a way to get a map. That is, we might, if a map is drawn in a GIS system, we'll import the map to our system. And what we said, what do most people want to do with maps? Reasonable question. We'll try to solve 80 to 90% of the problems, and we won't worry about the other 10% because they may or may not be particularly relevant. One thing, I call it the MapQuest approach, is we'll show you where you live on a map, or where the grocery store is, or the hotel, or whatever. That's standard stuff. A second one is we will use a map as an interface to a database. So we can search, use a map, and say, show me all the things inside this area. And the area can be a box, a circle, or a polygon. The third thing that we do, which is very, very powerful, is if you can think of a map on the wall, and you put a push pin in it, and then attach a Post-it note to the push pin. That's what we do, too. We put an electronic push pin in, and the Post-it note, if you will, is a database entry. It's a little form you might fill out that has all the information you want it. Now, remember, it's not hard to make forms, so it's quite easy to build applications around this. So that allows you to put data in. Now, it's not only just a push pin. You can outline any area on the map and attach information to that area, as long as it's polygonal or circle, oval shape. So this allows us to solve an incredible number of problems. So basically, whereas if you look at what has happened with Google, there's a thing called, was it Google Earth? If I get it right, Marcina? Google Earth allows you to look at the world and zoom in and all those. It's pretty nifty looking at it. But that's all it does. It doesn't have any applications behind it. And what you have to do to use that system is actually replace your browser with another one, and it's about an 11 megabyte download. This basically just fits inside your regular browser. It does use a small download, which will shortly belong to all browsers, which is called Scalable Vector Graphics. It's from Adobe. So much a thinner client, much simpler to use. We have notifications here whereby you can specify that you would like to know things in a, you'd like to know when something changes in a database, for example. So, and we can notify you. Currently, we can notify you by email, and some of these other things are still under development, but the idea is clear. We can send you a message on your BlackBerry. We can call you on a cell phone or whatever. There's lots of technologies now that allow you to pump in VXML, as it's called, and pump out voice. The agents are rather interesting. These are little agents that scurry around to do things. I'll give you a couple of examples. One agent will scurry around checking to see if two data sets are the same, or at least one could be a subset of the other to make sure they're consistent. Another one will actually go in and fill in forms for you. So if you had to fill in 10 forms with the same information, you just set this thing going and you type it once and then it will blast it out all the other forms. Turns out these are very, very powerful things. These are all, by the way, done declaratively. We just describe the agent in a declaration. We also do a lot of search engine type things, content indexing, keyword searching, error checking. We have some education tools underneath it so that you can put in the material. If you want, you can actually put material into the education tools yourself, or it might have education in it, which you can annotate. Again, very powerful stuff. And then, of course, we have, I call them hot graphs and charts, which basically are things you can go in and click on. Of course, the maps themselves are totally clickable as well. Just very quickly, we've done a whole bunch of projects. There's over 20 current and recent projects in various areas. People keep coming to us, and if the project's interesting, we take it on because we learned something from it. So community, arts and culture, economic development, social planning and interaction, immigration, health. We've done overall health system management, healthcare delivery, health system operation, health education, public health, and then environment, public oversight, water source management, and water management education. This one's interesting because it's a 10-course program which is being offered through the United Nations around the world, particularly the developing world, on how to manage water resources. And here's some of our partners. The City of Waterloo, Kansas Technology Triangle, Oxford County, Volunteer Action Center. I'll show you this one hopefully at the end. It's kind of cute. We built a dating service for them. But it has some interesting features about it that were kind of challenging. And so there's some companies in health. We have a company involved. We have the Ministry of Health involved, the Victorian Order of Nurses in Environment, Citizens Environment Watch, ComWatch, the Muskoka Lakes Association, et cetera, United Nations University. Now I'd like to put up some demonstrations here very quickly. I guess what, I'd like to put another 10 minutes? Just keep talking? Okay. This is one of our early sites. We call them community learning spaces, although we're thinking of changing the logo to say communities of practice because it's a little bit closer to what we're doing now. This is a site that lists all the arts and cultural resources in the region that are known to the Waterloo Region Arts and Culture Organization, RAC. And every year they would publish a book, or every couple of years, whenever funding was available, and this is something that cried out for an online operation. The book, for instance, one year it published people by category. The next time they published them by alphabetical name, which is not very useful if you want to find all the people doing dance, because you have to go to the index and go all the way back through it. So this one, we can produce everything in the cultural directory, or we can just look at something like dance. So here's all the organizations that in Waterloo Region that deal with dance. I'll just click on one here, the Cambridge Ballroom Dance Club. This immediately generates a little mini website for them. If they had a website themselves, it would be listed in here. This group doesn't. Here we have send a message. We don't publish email addresses on here, so no one can harvest the darn things. And then here's a little map showing where they're located. Doesn't help you very much because you're too close. So we can zoom out until we get some context. Probably one more zoom out will give us enough context to show us we're in, I think, downtown Galt. We can also search the directory. So we can come here, we can find all of the artists in all the people who do painting and drawing in Waterloo. So we just click on that, search, and that gives us all the people who do painting and drawing in Waterloo, quite a few of them. And then we can say find currently displayed locations on the map. And here's a map which will change shortly. It becomes a map focusing on Waterloo. And here are all the people. And if we run the mouse over any one of the red dots, does that not pop up? Oh, thank you. I guess there we are. Good. So there's Terry Burrows. That's where Terry Burrows is. He was a local elementary school teacher who taught my kids, as a matter of fact. So we can zoom out a bit on this. Or we can zoom, it doesn't help much, or we can zoom in. And as we zoom in, I've managed to get myself in the middle of the University of Waterloo campus, which doesn't show very many artists, unless the squirrels have taken up painting. So you get now a map, and you notice the map's changed as we moved in closer and farther. There's lots of examples of that. You know, you can start at a satellite photo at umpty miles and come into 10 or 15 feet with aerial photos and that kind of thing. So that shows one way of looking at them. We can let's go back up here and do a map search. And we have a map of Waterloo County, and we can zoom in, let's say, about there in Kitchener. And at this point, when the map goes wiggly, that means it's about to switch to a different format. And then we can search for people either by within a radius of our home, or draw a rectangle, or draw a polygon. I'll stick to something simple. So every time I draw the polygon, I have to do it twice. And we just hit search. Now, we could qualify the search and say, show me all the painters within that. But since there's only about 800 artists that we know about in this area, I think there's a lot more, but that's all the ones that are known to us, known to RAC. We just list them all within a given area. So that gives you we have similar information here called places and spaces. I won't bore you with that. Another interesting part of it is profiles. These are sort of like the Time magazine cover. These are local people who they want to feature. So these are the artists. And so we have here Ray Crossman, and we can click on Ray's name, and that'll show us it'll give us a little website, show us where he lives. Maybe he doesn't want us to know where he lives, in which case that information wouldn't appear. He could tell us to exclude that. Over here is a paragraph about Ray, which we click on, and here's Ray. Ray, by the way, is a professor of English at St. Jerome's College. And then, of course, in this case, we can do a little bit of multimedia stuff, I hope. Yeah. Oh, for Pete's sake. Okay. What's happening, guys?
Lie down in the bed. Look up. See your fingerprint on a cloud.
Right here? Oh, yeah. Let's go back and where are we here? Play it again. There we go.
Touch the sky. Touch the tip of the young spruce.
Yeah.
Behaviours. Come back.
Right.
Lie down on the needle bed. Look up and see your fingerprint on a cloud.
Okay, enough of Ray. We'll go to the press room now. The press room is interesting because it has a couple of interesting features in it that are quite user-oriented. One is that organizations can submit their own press releases. So you just submit your press release, and it goes into this database of press releases. The other part is that, I guess we could just show you, list them all. You can obviously search this for keywords. The searching is a moderately complicated search engine algorithm. The other thing is you can sign in and say, well, I am the entertainment editor for the KW Record, and I would like to know about all press releases that have to do with dance. So you could register yourself and get notified of this. Now, there are sites that have this kind of thing. What we've tried to do is generalize this, so it's very easy to build any notification mechanism you want. It doesn't have to be specialized to anything. There's a bunch of other stuff. I'll just click on festivals for a moment, although it's not actually for the web folks. I apologize for that, but this is one that was developed by a user. We didn't do it. we specified the database, and after that, the user built the entire system. Another user of this system went on, a professor of English, not Ray Crossman, another one at Renison, and she actually she wanted to do a studio tour of this area. So she built a brochure, which she actually pulled the pieces off and put it together in Publisher or something like that. And it was a very professional looking job. I was quite blown away by this. And she didn't even talk to us about it. She just brought it to us one day and said, oh, see what I've done, a couple of hours on a Saturday afternoon or whatever. Okay, let's see. I think I've covered all those guys. That gives you the flavor of this one. Is a little different. This captures all the water sources in a province of Malawi. We were working with some people in Ottawa who wondered if this technology would be of any value to them. And so they gave us this data, and we put together this thing. So this shows you all of the water sources. So we can look at all of the sources. We can look at rivers. And here's the information we currently are displaying: the village name, the river name, where it is. Now, obviously, a river is not in one place, but it gives you at least the point at which they are interested. The flow measurement. Now, here it says average distance. That means how far somebody has to walk to this water source, because close availability of clean water has a big effect on the economy of an area. So, and then we can show it on a map. Here we have an image of one of the sources. And there is, I believe that's only suitable for washing and things, but pretty awful looking stuff. We don't have a lot of pictures. We do have a few. Let's say there's a few other ones down there. And we can, of course, put all these on a map if we want. There's all of the water sources. Now, in this case, we only list 50 at a time. There are almost, of all the water sources, there's almost 2,000. But if we wanted to, it would be very simple to go in here and actually list all 2,000 at once. Just say make the report 2,000 lines long. Doesn't cause any difficulty whatsoever. It's very easily done. Now, what we were thinking of doing is attaching a tool like this to the education material. We have the education material for water quality management. We could attach this tool to it so people could actually, on the ground, in their own village, with little training, help to manage their own water supplies. One of the things I didn't show you on there, by the way, was fecal coliform count, which is not something you really want to have around. Fortunately, most of these seem to be zero. Here we have, I just switched while I was talking into administration mode. This now gives me the ability to manipulate a lot of this, and I'm just going to show you one little piece of manipulation. For instance, I could change these forms. I could change how many entries appear. I could eliminate some columns. I could add columns, etc., if I had the data to add. But if we just go here, this gives us all the information about Adamson, including where it's located. And this is one of those little things I talked about, putting a push pin in the map. I decided it's not really there, it's over there. So I can just pick the thing up and move it. And down here, of course, the coordinates have changed, I hope. Yeah, they changed. Those are what are known as UTM coordinates, by the way, Universal Transmercator Coordinates, which is one of about 200 different ways of measuring your position on the face of the Earth. Now, I won't update this because that would change the database and people might get annoyed with me. But that's the kind of thing you can do. And the people within the community, those who are authorized to do so, could do that very easily. The last one is sort of my favorite at the moment, because we did this all with our technology, and we improved our technology. What happened is the Volunteer Action Center in town came to us and said, could you help us? We would like to build a website. Now, they had a website before. All it did was list a few things, and it was just a bunch of HTML. It was just terrible. By the way, the other thing to notice is if you go and look at these pages before they're generated, they're blank. It all comes out of a database. So it means if we want to change anything, we just go into a database and make a small change. And they came to us, and they told us what they wanted, so we built it very quickly within a few days, and then they came back and said, we don't like that, which is a usual problem with groups. Then so they worked with us. They tried this out with a whole bunch of different organizations to find out what really worked. And so this is eventually what they came up with. You notice, by the way, they went out and bought a bunch of hands. You notice the hands are changed. They bought a CD full of hands. The thing they discovered on the CD, there's no wrinkled hands on there, and they want some wrinkled hands because they want older volunteers. So they got to go and find a couple of wrinkled hands somewhere. And then down here is some of the things you can do. Volunteer opportunities is the most interesting part, because this is the opportunity you have. Like volunteer organizations, I should explain how it worked before. Volunteer organizations would phone this organization and say, we are looking for people to drive for the Cancer Society, for example. So they would take down all the information on a piece of paper. They would then fax the piece of paper to all the libraries around town that had a copy of their books, if you will. So if you wanted to volunteer, you basically come in and thumb through all these books. Okay. Now, this, by comparison, as an organization, you go online, which it's securely online in the sense of you have a user ID password. You put in your volunteer position, and then the, excuse me, let's see, what do we want here? Search by no, that's not the one I want. Search by areas of interest. I think that's it. Yeah. So, and then they have categorized things into areas of interest. So if I'm interested in computers, I can submit that. And then it will ask me a few more questions. Very few. I've forgotten. There's about 4 things I have to say. I can say more, but I don't have to. So N2L2T6 is my postal code. I think I have to tell you that I'm, and I think I have to say I'm retired. Everything else, we'll find out in a minute. There are all the positions that have something to do with computers for which I could possibly volunteer. Then I can go to each one of those. Now, I cannot volunteer online. I can find the positions. I still have to go to the organization because they want to keep control. But the fact is you couldn't do this before. You had to go to the library, look. And we've discovered a few interesting things. There was one organization which each year they look for volunteers around Halloween. It's basically UNICEF. And last year they got 1 volunteer. This year they had 35 within about a week of the site going up. Now, 35 isn't very many, except the lady who was getting all the emails was complaining because she had far more she could handle. The good news was it was her husband who was taking care of the volunteers, so she didn't care too much. And it's quite amazing. This site actually went public on September 17th. And we actually went public 2 days early to make sure it worked, because nothing would be more embarrassing than promise to launch something on Saturday and it didn't work. So it worked, and we had 800 people look at this before the site was even announced. So the interesting thing about that, that's the fun part, because that's where the people who worked with us on this really got excited. To us, we're excited because we produced something that we thought was kind of neat. But what we ended up with is a small contract idea. They defined the language for us, so we didn't have to sit down and figure out the terms and everything else. We didn't have to put it together like we will probably have to do with smoking. The people in smoking will have some ideas, but they won't, I don't think, have fleshed out their view of smoking as well as will be needed for a computer interface. So we'll have to get into the ontology business. But here, they were able to define things for us, and they were able to, we were able then to build elementary contracts. And those contracts then link up with the physicians that are available. Again, that's not a hard database problem. It's more a case of putting the right pieces together in the right way. The other, excuse me, part that is not here yet, but will be in within a week or two, I hope, is the ability that you put your profile in and it gets saved. You can save it now, but you will be notified if a physician comes up and matches your profile in the future. Now you go in and edit your profile anytime. That's again protected, so only you supposedly can edit your profile. The profiles are not available to the volunteer organizations, and there's a huge amount of data collected here. Commonly, excuse me, David, statistics, which is very valuable to these people because they get their money based on how many people in Kitchener volunteer, how many people in Waterloo volunteer. Most of the time, they haven't a clue as to what's really going on. So it's a really fascinating problem, and it revealed a lot of interesting issues that we hadn't think. Some of them were silly issues from the point of view of a computer scientist, but they didn't want the color quite the way it was here. Could we make it easy so that could be changed and things like that? So again, those are some of the things that we've done. And that's it. I can go on for hours about these sites. We've got about 20 of them, and we've done things in the Ministry of Health, which are kind of interesting. Learned what their problems really are, not what we thought they were, not that what they thought they were. Because by showing them stuff, you could actually find out, get inside their head. Any questions? Or?
So the other thing I'd ask is be patient so I can get you the microphone. There are people watching this by webcast, and I'd like them to be able to hear questions and comments. So questions and comments.
Oh. I did it.
You did it. You fooled everybody.
Yeah.
I just want to close the loop. Like I understand the issues with population health,
sure.
And I was really interested in your web pages. Could you just say a little bit more about how they're linked and how you plan to put them together?
Well, basically, I'll give a simple version. It's a little bit. We haven't got everything perfectly refined. I'll confess that. In fact, we're still trying to generate a good theory that. I mean, we've got parts of the theory in place. But we're trying to generate a good theory that we can, if you like, write a book about and say this is how to think about things and then how to do them. But basically, those reports and things are we can create the databases by filling in a form. We can create the reports by filling in a form. To get the appearance, we actually can suck the information out of a database. We can put it into a form, and then it generates style sheets of various kinds. I can't remember which flavor at the moment, but anyway. Does that answer your question, Jeff, or not? Or is there?
And then, so somehow schools, for example, would have maybe a school would have an account on some smoking statistics web or
yeah.
COP.
Yeah, a school like the school principal, let's say, could belong to the communities of practice, or the public health people could belong to a community of practice, maybe the same one, maybe somewhat different. They would join, they would fill out a contract, something like we had there. Probably a lot more information would be required because you want to, you'd have to make sure that the keywords meant the same things in different sectors of the country, for example. Or you might even deal with dialects by, putting dialects up in front of those, what was the standard keyword. But so they would fill it in. They would then access the data, or whatever data they were allowed to access, or had requested to access, and there's issues you have to deal with there. Should they be able to look at schools in their general neighborhood, or just schools in another province, because there may be issues of privacy, et cetera, that are important. So another interesting issue that comes up, which I have nothing to do with, but is the data that they collect. Students are moving through the system. So, but although the data they collect will not reveal identity, it is possible to match a student all the way through. So a student entering in grade 9, when they leave at grade 12, and they do the survey that year, they will know that that's that student. But you can't identify the student.
One quick question is, the idea here is to get users to actually do this.
Yep.
What's the big boundary there? I mean, what's the thing they have to jump over before they get the picture that this is something that's doable and something they can do, and then they know how to do it?
Well, there's a number of issues. Issue number one is making people recognize in general that an IT structure, something like we've got here, is absolutely essential to being able to manipulate this data. Okay, without it, you're going to be dead. And some people have got it, but a lot of people haven't got it yet. They're so busy dealing with, what can I say, the immediate problems, they haven't looked into the future. That's the one part. Second part is you've got to get a few people interested in working with you, and they will become the seeds. They'll become the leading edge, so to speak, and then you'll get most of the other people picking it up if they see it's easy to do. One thing we don't do well right now is the statistical stuff. We can show you some stuff, but it's a little bit fake. So, for instance, David Chodos here is working on a statistical system, and we have to decide, should it be able to do just about everything? Should it be able to work as well as SAS or SPSS, or is there a minimal set that we really need to deal with? But, a lot of people out there, for instance, the public health nurse or whatever, has got to put together a report for city council. Well, all they want is a few charts. They really don't want a lot of in-depth information. So, is that the level we deal with or not? I'm not sure. We're not sure yet.
Do you give them a model of the system or an understanding of the system so they know where to start and what to do? I mean, do they have a view of this thing of some kind that lets them think in their normal nursing ways about creating a system, or how does that work?
Well, I mean, with the Volunteer Action Center, and that's, I think, the best example I can think of. In most other ones, we've kind of, I'll say, pushed it on them a little bit. In the Volunteer Action Center, we said, well, what do you want? And they came to us and described what they wanted. And I think this is why I found this one so exciting. And we built it. We built it very quickly. That's one of the parts of this. It's rapid deployment. And they looked at it and said, we don't like that at all. Well, that's what you asked for. And then we went through a refinement process with them. And they went out and talked to a lot of people and showed this to real users who would then, they'd find out all the issues. And from what I can tell now, we've between the two groups, we pretty well hit it. But to me, the most exciting part about this is we've got a whole new way of dealing with software technology. I like to think it is anyway. And we got people out there who are willing to be guinea pigs, which is very good. And we try to deliver something so that not only they get value for being guinea pigs, and not just guinea pigs. We just don't go in, do something, and then walk away and say, well, it was nice knowing you. We actually go in and work with them. So.
Questions, other questions or comments? Anybody from anyone? I thought I'd take upon myself a challenge that you gave at the beginning. You said you were going to relate volleyball to software. So in the time I had in your presentation to think.
Oh, geez. Here we go. No,
I came up with only about 7, not 10. So examples. The net plays a big factor in both of those areas. Okay. Programmers and volleyball players both have a ball, obviously. Very important. I'm trying to read this. Both much software and much volleyball playing are built on sand. Both software systems and volleyball games have servers. And they both share the same acronym in the case of Visual Basic, VB, for volleyball. And the final thing is volleyball has beautiful software. Don, thanks very much.